the witnesses.
Pay it forward. Karma. What goes around comes around. These are common philosophies that we as a society believe that indicates that whatever good or bad we do is going to come back to us in some way. Let's apply that to donating blood. 1 in 4 adults will need a blood transfusion. There are 3 types of blood transfusion. There's red blood cell, which is generally used for surgeries. According to the Mayo Clinic, a hip replacement requires that 1 unit of blood typed to the person having surgery be available before they'll even attempt the surgery. For cardiac bypass and heart transplants, 2 units of blood must be available. For a liver transplant, there must be 10 units of blood available before the surgery will be attempted. Also, with the red blood cell donation, these are used for anemia, maternal fetal problems such as postpartum hemorrhage or RH incompatibilities, and then trauma. A single trauma patient can use up to 50 units of blood. The second type of donation can be for platelet and clotting factor. This is used for people with hemophilia. A person with hemophilia does not clot, so a small cut or an internal injury can be life-threatening. The third form is plasma transfusions. These are typically used for burn patients, cancer patients, liver failure patients, and those with severe infections. As you can tell, it would be very easy for someone needing blood to touch your life. It could be your grandmother who needs a hip replacement, a school friend who's been in a motor vehicle accident, or perhaps your grandfather needing some type of heart surgery. By giving blood, you can pay it forward. The process of giving blood is relatively simple. The first thing you want to do is make sure that you meet the primary criteria, which is that you must weigh 110 pounds and you must be 17 years of age. If you meet those 2 criteria, I would encourage you to at least try to give. There are medical conditions and medications that preclude you from giving, but it doesn't hurt to go and be screened to find out. Once you attempt to give blood, you'll fill out some paperwork that will ask questions that may throw you out of the process, depending on how you answer. You also will have your hemoglobin checked. You must have a hemoglobin of at least 12.5 to be able to give. This is the bad part of donating blood, the 2 needle sticks that you have to undergo. The needle stick for the hemoglobin is in your finger, much like you have done at the doctor's office. And then, of course, the actual donation of blood is done through your arm. So once you've passed the screening, you're put into a comfortable reclining position. The needle's inserted to draw your blood, and you may be asked to pump some type of sponge to help the blood flow. The actual process of donating blood takes from 10 to 15 minutes. Once you're completed with that process, they take everything off, bandage you, send you to the refreshment table. You're encouraged to hang around for 5 or 10 minutes, to drink plenty of fluids, to eat something, to make sure that you will not pass out on your way out. So you say, okay, I tried. What happens to my karma if I'm unable to donate blood? There are always other things you can do to help with the process. You can encourage others to give blood. You can be a friend and hold someone's hand while they give blood. A lot of people have a needle phobia. Just having someone there to help helps with the needle phobia. And then if all else fails, you can volunteer. You can be the person that gives the refreshments and the drinks, or you can help with the check-in. There are many things that you can do to help with blood donation. In the words of Maya Angelou, I have found that among its other benefits, Giving liberates the soul of the giver. And if the nice, easy push doesn't get it for you, just think of Nike. Just do it. Thank you.